So what we have done is left it open to individual speakers. So our default has been just in person, not even Zoom. This semester, because we started off with such cold weather, we went to a hybrid format, and then I kind of realized, okay, more people are coming on Zoom. We should offer that option. So now we're doing
I went back and forth, but because I thought it would not be good for me to be on Zoom and I'm just right across campus.
right.
Yeah, but this is a time that's difficult for many of us. So many things are scheduled during this time that I need to go to. And
Right.
I can't.
Feel free to do whatever. I'll try to keep it covered.
So the recording of some will be helpful.
Yeah.
Let me get
So
from this
we have
camera,
got
though. I
a
won't be able to
couple of
touch
our
it.
talks recorded and available on our YouTube channel.
That's good.
But I think most of the presenters have taken the line that, we're seeing this more of an informal conversation.
As it should be, kind of work in progress and see where it goes with people's reactions.
Yeah, that's right. This is always fluid, and the Monday lunchtime time slot. Do you want to stick with?
Oh, that makes sense. The only thing I will say is that I can never come to these things because everything on this campus is scheduled in this time slot throughout the week. And that for me is a continual, including department meetings and department sessions and things like that.
Right.
And nothing you can do.
Yeah, and I know, like, I'm in the history department, and we always do our meetings Wednesday lunchtimes because there aren't that many classes scheduled, and so that was the thinking behind the Monday lunchtime.
Well, and in political science, we have classes scheduled throughout this time,
Right.
and before and after, and research seminars all over the place are scheduled during this time just to make sure people are here. But there's no good time.
Yeah.
Anyway, but there have been
like
things
that
I've been really
conclusion.
interested in seeing, but this, however, was on my
All right, I'm just going to get my Zoom thing
I keep thinking, David, of things I wanted to send to Jim Perry and not say, leave him alone.
Joe, is everything good on your end?
Yeah, I'm rolling everywhere.
Great.
You can start whenever.
Good. And I just joined the Zoom, not signed in with my account to Zoom, so you may have to let me in from the waiting room, I think. Yeah, sorry about that. All right. Hi, everyone. Welcome to the Center for Humanities weekly seminar. I'm Paul Quigley, director of the center. Thanks for joining us in person on Zoom. We're really glad to have you with us. This week, we have David Bredenkamp speaking to us. He is a Collegiate Associate Professor in the Center for Public Administration and Policy. And just in case you don't know, that's part of the School of Public and International Affairs, which in turn is part of the College of Liberal Arts and Human Sciences. So that's where the center sits administratively. Dr. Bredenkamp's research interests include public management, organizational behavior, public service, and human resources. And today's talk comes from a larger project exploring how we define the concept and the term Frontline in Public Service. Over to you, Dr. Bredenkamp.
Thank you so much, Paul, for this opportunity, and I want to thank the Center for Humanities for offering this seminar all year long and offering me the opportunity to share my work with you. As Paul said, I'm David Bredenkamp, and my larger research agenda, I'm zooming out a little bit today on frontlineness in public service. One of my particular research interests is in the attitudes of civil servants. I want to know what civil servants feel about their jobs, what keeps them coming back, what makes them stick with it year after year. And so frontlineness has become a really big part of that research agenda. We're going to talk about the definition of that in just a second. But after we talk about frontlineness, I want to talk about some of the more grounded foundational research of this concept, which is public service motivation, and some of the contextualization problems we have with public service motivation theory. I'm going to illuminate two papers that I'm working on with you today. The first is a scientometric or bibliometric analysis of medical field research dealing with frontlineness, and the second is a paper using narrative inquiry and interpreting those narratives in the behavioral health field. And then I'll talk a little bit about some future research, in particular with some of the contextual elements of frontlineness that we've discovered in this research. So frontlineness. When we talk about frontline, this is a term obviously derived from being on the front lines of battle, and then also translated into being on the front lines of the service industry, any kind of service, whether public, private, nonprofit. Being on the front line means that you are face-to-face in some way or making a point of contact with government as a citizen. So citizens meeting their government in certain places in the public service. There are huge foundations in frontlineness in street-level bureaucracy, almost to a fault, perhaps. So we have heavy reliance in public administration on the author Lipsky and the concept of street-level bureaucracy. Chang and Brewer in 2022 did what they termed a meta-analysis of street-level bureaucracy and only used articles in that meta-analysis that were either by Lipsky or cited Lipsky. So we're a little bit walled off, as it were, in public administration on what it means to be on the front lines of public service. There's also some grounding in public administration, in part by Charles Goodsell, with what he termed a public encounter. And that is the transaction or the meeting of people in public spaces with their government. So citizens or residents or service recipients actually meeting face-to-face with their government and getting a service or having an interaction. There tends in public service work to be a binary distinction. You're either on the front line or you're not. So you're either meeting face-to-face with the public, offering services to them, or you're in the back office doing administration and not on the front line. Obviously, that's an oversimplification of the real world that I want to interrogate. There's also little to no investigation into different fields. I'm not saying that there is not some interdisciplinary flavor to the study of frontlineness, but we don't really delve into the research of other fields like medicine, behavioral health, public safety, that kind of stuff. The research that's done in those particular fields is kind of walled off from the public administration literature. So what I want to talk about a little bit is the different conceptualizations we have of frontline work. And I think this changes over time. This has changed over time. Public service is very different today than it was in 1950. So my quintessential example for all of my public management students is, say you're at the DMV, the Department of Motor Vehicles, right? I, for one, have had amazing experiences at the Virginia Department of Motor Vehicles as compared to my home state, which I'll leave blank right now. I won't mention it. But the DMV is this quintessential public encounter. You go, you take a number, you sit, you go up to the window, you get the service, and you leave, right? This public encounter, it's very systematic. Then we have these interactions with public servants that deal with something a little more complex than that. Cops, Teachers, Counselors is a book by Mater Mooney and Machino that focuses on the stories of frontline service employees. These particular cops, teachers, and counselors tell their story about what it's like to do their job. They have a certain method they go about to illuminate what it is to be on the front lines of service. There's also this delineation, classic public administration will say, well, frontline public servants are on government payrolls. Right? But since the 1980s, government has been blurring the lines between sectors for decades now, with contracting, nonprofit relationships, intergovernmental relationships from local, state, and federal. So just being on a government payroll isn't the only qualifier to be in public service. There's also the classic idea that informs frontlineness that is the shadow government. I don't want to confuse this with the contemporary term of the deep state. That's something different. Shadow government, when it's written and published prior to, say, 2010, I would say, is the idea that we don't just have government employees, we have employees who are very government adjacent that we don't consider necessarily as part of government. So defense contractors, for example, much of their revenue comes from tax dollars, from government money. So how private are they if they are in the shadow, so to speak? There's also this concept of hollowing out, which has its detractors and its promoters. The hollowing out concept kind of took off when in the 1980s and 90s we were focused on contracting out a lot of government functions to private companies. And there was this thought that in so doing we would hollow out government functions and government would be more in charge of oversight rather than actually doing the things. There's some evidence for that and some evidence against it. But really what Paul Light was trying to get at was, what is the true actual size of our government? And when we have a government that goes beyond the government payroll, what's it like to work in that environment? What's it like to be on the front lines representing your government and or a private contractor who is part or is in a relationship with the government? What's it like for frontline workers to be there as the face of government, even with all of these blurred lines being the reality? A more recent example of frontline work is the onset of the COVID-19 pandemic in early 2020. I was talking with Paul before the presentation. I said, the first 6 months of lockdown, we were absolutely extolling the virtues of essential workers, even changing the definition of essential workers in government and outside of government. Private organizations were deeming people essential to bring grocery deliveries, right? But after 6 months, people started really questioning tipping culture, right? We kind of flipped a little bit. Our perception of how important frontline work was as a society morphed in just even that short amount of time. So can we imagine, if we looked over the course of 50, 60, 70 years, how society's value that we place on frontline workers has evolved and changed and morphed. So this is what I'm after with this larger research agenda. I want to talk about some of the issues that exist with the current public service motivation research. In 1990, Perry and Wise introduced the motivational basis of public service. There are 3 of them, 3 categories. The first is rational, and that is, I needed a job, and this public sector job was the job that I applied for, and I got that, so that's my job. I was drawn to it because it was a job. I was drawn to it because I need a paycheck, right? That's the more rational side of public service motivation. The other things that draw people into public service fall into the second 2 categories. The first is normative, which is, I want to give back to my community. Service is good, I want to serve. That's more the normative framing of motivation for being in public service. And then the third is affective, less intuitive, this term. It's basically issue-driven. So you have a certain issue, a certain thing that you care about, and you want to pursue employment with that issue. Say you really care about the environment and you want to go work for the EPA. That's your draw into public service. there's some contextual issues with this. Motivations differ across fields. My mom was a teacher for 30 years, and I would imagine that her motivations for going into that were very different than someone going into military service. But we lump them all into public service, right? So these motivations will differ across fields. Also, at the individual level, different jobs have different elements within the same field that are appealing to different kinds of people. And so when we're talking about attracting people to the public service and what may motivate them, we've got a whole menu of things that we could be dealing with that actually motivate them toward public service. The other part of this is structural, that there are elements of public sector jobs that differ according to purpose and goals, especially from private sector and nonprofit jobs. A lot of times public sector jobs have goals and purposes that are more ambiguous, for example, or they stretch over time and measuring what success looks like becomes more difficult. So these contextual issues can really help us define or refine what we think of when we're talking about why are people doing this? Why do people stick with their public sector jobs? And then, as I said before, there are increasingly different ways to serve, not just government payrolls, but nonprofit organizations and private organizations as well. So paper one, the first paper I'm going to introduce to you today is, it illuminates some opportunities in the medical fields and when and why. So taking it a field at a time is sort of my way of biting off a piece here at the start. Service delivery is a big component of the medical field. Nursing, primary care, hospitals, technicians. It is about people getting services from individuals and organizations and having those public encounters. Telehealth has made this even more true. So we connect in different ways, but that's still connecting as individuals with organizations and meeting each other in these encounters. The medical field is also a really good test case for this approach because it is such a hodgepodge of public, private, and nonprofit delivery. It offers all these opportunities of, in the United States, we have public hospitals, private hospitals, nonprofit hospitals, private care, public care, all of this tapestry that comes together as a really good example of how these sector lines have been blurred. The scholarship, there are databases of scholarship in the medical field that are seemingly not tapped, especially by public administration. We are walled off as a field, and contextualization is also really difficult. It's much easier to count public servants than it is to go listen to them, right? So this qualitative element of research is something that needs to be pursued, and I'll talk about that in paper 2. But knowing what's out there and how each field frames its scholarship and what might be there for us to look at to define frontlineness according to field, more specifically, is a really big opportunity that I want to see what's out there. And then we also have evidence synthesis as a tool, which can really be helpful for figuring out what we know. And I don't know what we know yet from the medical field on frontlineness because we're not dipping into this scholarship. So paper 1 is Health Worker Potential for Expanded Exploration of Public Frontlineness, a Scientometric Analysis. As you will see, I believe some of my co-authors may be in the audience today on either one of these papers that I'm going to show you, but you'll see that Cosette Comer and Connie Stovall are 2 library, VT library employees, and one is a PhD student who have been immensely helpful in the evidence synthesis area doing scientometric analysis. So just a little bit of background on scientometric analysis or bibliometric analysis. It's the precursor that we're using to actually going into a full systematic review. I want to see what the potential is in medical scholarship for helping to define frontlineness in this way. The research question is, what is the potential for existing research to describe the proximal relationship between a frontline healthcare employee and the frontline itself? All right, so we have executed Scopus database searches, 2013 to 2024. We included journals, conference proceedings, reviews, books, and book chapters, but works such as editorials or full data sets were excluded. So it's the journal-based scholarship in medicine that we were interested in finding. Because of the limitations of our research team and the languages we speak, we are only delving into the English literature that is printed in English because we don't have translators. So that's a first stop. So the conclusion with this is, and this is preliminary, but will be pursued in a paper coming out this spring, there are thousands and potentially tens of thousands of potential sources to explore frontlineness in the medical field, totally untapped by public administration. So our next steps after this paper will be to isolate the relevant pieces through abstract and title and systematically review what we know in the medical field about being on the front lines of public service. The second paper is housed in the behavioral health context, specifically in Virginia, the Commonwealth of Virginia's behavioral health system. There are inpatient behavioral health facilities around the Commonwealth, and we did interviews in 3 of these facilities, which I'll talk about in just a second. I believe my co-author, Alicia LaRiviere, is in the audience on Zoom, so she can feel free to jump in during the question and answer if necessary. But she is what we would term, or was what we would term, somewhat of an embedded scholar with respect to the Commonwealth behavioral health system. And so she has a lot of insight into the context that we were investigating here. The research question is, how do behavioral health workers across occupational categories, so psychologists, nurses, direct service professionals, administrators, explain what they do using their stories to reflect on frontlineness across practice settings? We did 33 semi-structured interviews averaging 45 minutes apiece. That's a lot of text. 2022 and 23 is when these interviews occurred. They were on site or via Zoom in a pinch where we couldn't meet face-to-face with someone. The first question we asked them was, please take about 5 minutes to tell us how you came to be in the job that you know. This gives us a historical, some people took a lot longer than 5 minutes, I will tell you. But that was great because we got the information that fed into why they're there. What's the foundation? The second question we asked them was, please tell us a story you remember well, about one or more work experiences that help us understand what your job is all about. So this is a really open-ended question, and that was intentional. We had some ideas about what people might say as an answer to tell us a story about your job. We didn't want to prime them to tell us something in particular. And so we wanted the question to be sufficiently specific that they understood it, but sufficiently broad so that they would feel free to tell us what they wanted to tell us. And it turns out our predictions were pretty spot on what they were going to tell us. The responses were really consistent with an old favorite in public administration, self-determination theory. Self-determination theory is based on the idea that if a person has some say about their own job and how they go about it, they will be more likely to stay in that job, be more satisfied in that job, and be more fulfilled. The first element of self-determination is autonomy, and this came up over and over again in these stories. Having the freedom to decide how to go about doing their job, even in an inpatient behavioral health facility where, there are policies everywhere, right? This is a very regimented organization, and yet we hear people who are having to follow policy and do things the right way all the time and follow the rules. Having freedom to execute their job the way they see fit was really important and came up over and over again in the stories. The second element is association or belonging. So a sense of belonging to the organization, belonging to a group of employees informally, belonging in some way, belonging to the team, for example. This came up over and over again. We had one respondent who talked about going for birthday dinner after work for each colleague that they had. And they had T-shirts with a nickname that they gave their group. Right? This was not part of the job description, obviously, but that sense of belonging informed how they approached staying and working in their job. And finally, the third component is competence. This is why I was really glad we asked give us a 5-minute rundown of your previous experience on how you came to be in this job, because they listed credentialing, they listed past experience, they listed things that you could tell were, even in the moment, were giving them the confidence that they're where they're supposed to be and that they feel competent at what they do. And if they have any feelings of doubt on that, they work toward working that out. Like they work with their colleagues to get that training that they need, or they pursue being better to be competent in their job. The responses were also really consistent with the motivational basis of public service that I mentioned earlier. The rational, we had several folks say, you know what, I was in a really high intensity job and I really wanted something not as intense. And so I chose this function, and I'm here for the paycheck. And I come in, do my work, and I go home. Yeah? We had people respond with this, since I've been a helper since I was a child. You know, I want to give back. I am drawn to service, right? It's that normative argument. And then we had the affective. I've had people in my family or in my life who have struggled with behavioral or mental health, and I made it my life's calling to make things better for them. And so that's the affective, that issue-driven the element of the motivational basis of public service. So we saw all of these very, very clearly and consistently. With 33 interviews, we wanted to get, diversity of stories, so we selected various roles, but we started hearing similar patterns over and over. By interview 20, we were hearing, yep, there's that. And so we were getting saturation. We were getting story saturation with the interviews that we did. So what we discovered on the way to these interviews and beyond is that there are certain elements of frontlineness that really stood out to us in these stories. And there is some preliminary research right now being done on frontlineness from the perspective of the frontliner. So the emotional bases, the inside of the individual frontlineness. I feel very frontline, in other words. What I'm really interested in are the contextual elements of frontlineness. What makes it a frontline job? What makes people interpret it as being on the front lines? What are the structural elements? And there are 4 elements that we came across. And the first one was proximity and adjacency. This is put into stark example with behavioral health nurses dispensing medication with plexiglass in front of them as patients are in line to get their medications. This is for their protection as well as the patients, right? That proximity, they're close, but they're divided. There's a barrier, right? The qualitative nature of that proximity or adjacency matters. And even in a virtual situation, there's a proximity and adjacency. It's just digital. The second is time. And that could be the length of people's shifts, the number of hours that they spend, but it could also be, if you're in a high intensity situation, how much time is spent in that intense situation, right? So what is the quality of the time that's being spent? That leads into the intensity. If you are in an 8-hour shift and there is a lot of stressfulness, or you have to be on for 8 straight hours, right? That is a really intense situation. That's a variable that we can look at and what might inform how we think of frontlineness. And then finally, the vulnerability. There are high-risk jobs in the public sector. The assumption of risk to mental or physical well-being is taxing. We've got one of our scholars, Dr. Sharon Mastracci, in the audience that deals with emotional labor quite a bit. And stress and vulnerability on the job are part of the emotional labor that are expended by public servants. And so I think that's a foundation for these pieces or elements that we can use to extrapolate what frontlineness really does mean here and now, and not just what it was decades ago as street-level bureaucrats. So I want to thank you for your time and letting me share my work with you today, and I'm really excited to hear your questions. So thank you very much.
All right, thank you very much. Lots of interesting stuff in there. Lots for us to talk about. So it looks as though we have a question already oh no, my mistake, we did not yet have a question on Zoom, but I want to encourage people on Zoom to raise their hands if they have a question. And same with the people in the room, only you do it literally in the room. And the important thing is, if you're in the room asking a question, to speak into the microphone. So does anyone want to kick things off? Okay. And I'll just leave this mic with you. You can pass that along.
Thanks, David. I always learn from you and your presentations. I'm perhaps the least directly relevant to what you're doing, but I want to go back to this focus on what you're calling medicine and the medical field.
Mm-hmm.
And as someone who spent a fair amount of time working in a medical school, doing research within that medical school, but also working in Department of Health and Human Services in a particular line of work that had to do with contraceptive devices and things like that. My question really has to do with how does one draw the boundaries around what you're calling the medical field? That strikes me as needing plurals of all kinds at both the front line and the delivery level, but also across the substance of what people are doing. And so I'm thinking, for example, of when you say medicine, you're talking Western medicine,
Mm-hmm.
presumably, but what kind of Western medicine? What we think of as MDs, what we think of as osteopaths, what we think of as homeopaths, or a whole range of others. What got included in your definition of what counts as medicine?
This is a really good question, and you're exactly right. We've had to draw and redraw boundaries around what we were considering with this. And so we didn't explicitly exclude homeopathy or anything like that, but by a function of the nature of the databases, we're getting a preponderance of Western medicine and that field. So as a function of that is a limitation. However, our searches and our refinement of the searches for terminology that is used, or by phrase, in these works, has by necessity narrowed and helped us figure out what we were really after to begin with. This paper started as an advanced topics PhD course, and luckily some of the students stayed on as fellow researchers and co-authors. And so we talked for that semester about, like, what do we even mean by this? And where are the boundaries? What are the inclusion criteria for what we are going to count as possibly lending some knowledge about frontlineness to us? And so we very much parsed through thousands of terms that came up over and over again, numerous times, from these pieces in Scopus database for the medical field. And go ahead, did you have a follow-up?
Yeah, I do have a follow-up. That's really helpful and important to probably highlight as well. I don't think of less as a limitation. I think of it as a strength, because
Okay.
it's encouraging to us that one has had a clear sense of how to limit and draw the boundaries. And I do think for methodological and other reasons, as well as credibility reasons, that's important. A final related question about boundaries, and then I'm going to give up this microphone, because you know what happens when I get a mic in front of my face. But it has to do with the interaction, even at the front line, of the nature of the practice. And what I'm reflecting on is my sense of, especially in Western medicine, particularly after moving to a rural desert like where we are in Blacksburg, Virginia, that's at least my notion, that there's a real interaction among the value placed on certain kinds of specialty practices. And I will just go back to my experience in a pre-professional undergraduate program with lots of pre-law and pre-med. It was very clear that surgeons and neurologists were at the top of the heap, and not in the same category or other kinds of really important practice areas. And what I don't know is to what extent that interacts with the nature or the quality of the frontline delivery that you're picking up when you talk to these people.
This is really interesting, and thank you, Dr. Holt. So we had to be really careful about the interpersonal dynamics of medical professionals and those they serve, and drawing a really clear line that their interaction with each other AKA nurses and surgeons, nurses and doctors, techs and nurses, was beyond the scope of what we were looking at. We were focused on the relationship between professional and service recipient. And so anytime it was intra-organizational, right? It was inside the organization. Generally speaking, we excluded it. And then,
My question is different from that.
Okay.
My question is not, that relationship aspect is clearly fine, but it brings with the culture and one's definition of oneself as that frontline person in terms of how they're seeing the world and how they're interacting with the person they're delivering the service to. And I don't know how one gets at that, but that's one
Yeah.
of the things I'm thinking about in terms of motivation and affective versus normative and things like that.
yeah, there may be another contextual element there that has to do with,
Professional culture or
yes,
self-culture or
self-perception.
something like that. And self-perception.
yeah.
I'll shut up now.
No, absolutely. Thank you. That's good food for thought.
Thank you, David, and thank you for the shout out to emotional labor, because certainly there's, I see synergies for sure.
Yep.
So my questions actually are not unrelated to these questions that Karen posed. And I have two separate questions. The first one, it seems to me, is that you're trying to parse out in the literature a difference between being the face of, and it's a separate question of being the face of government. Because it's one thing to be a face of something. Or are you not? Are you saying that that frontlineness is actually the same? I don't know. I'm questioning myself as I'm asking the questions. Like, are you saying that frontlineness differs by sector, or absolutely not?
I'm saying that I didn't put this in the presentation, there are more similarities than differences.
Different in all the unimportant ways, as we know in PA?
I think that having been in a frontline situation in both public sector jobs and in private sector, I think there are differences, as I stated in the presentation, like with goals and the ambiguousness of goals sometimes, right? And that can be at the individual level, group level, organization level. But what I think is really important is that that interaction happens regardless, and a lot of the same behaviors are expected from that frontline worker. Right? When we go to a doctor, there's not that much difference in what we expect of the demeanor of the person who's checking us in than there is at a checkout counter at a grocery store. Like, that behavior is the expectation of society is very similar on what we expect, just on the basis of, say, a modicum of respect and knowledge about what you're supposed to be doing, right? So I think that there are more similarities than differences, but I would never say that it's exactly the same from public to private or to nonprofit. Did that answer your question?
It does, and I'd take exception to a grand claim about there being no differences, just as I take exception to the claim that management is the same across sectors. I don't, and only different in unimportant ways.
Yeah, I agree.
Something I find very interesting, before I get to my second question, is the power dynamics that differ depending on the sender and receiver of messages in any Charles Goodsellian public encounter. My argument is that the power dynamics that change when you're at the DMV and you can't go to the next door DMV to get what you want. That's like there's one provider of one of only resort. That changes the dynamic.
There's no competitor for the Social Security Administration.
Nope. And that changes the power dynamics between the service delivery
Yeah.
and the individual.
Yeah.
Okay, so separately, my other question is not unrelated to Karen's question, in that I'm curious how you've come across the literature on professions, because professions are defined in some very important ways that really relate to everything you're talking about. Like, we monitor ourselves, we govern ourselves, I have autonomy. And to the extent that one identifies themselves with their profession before whoever the heck they're working for,
Yes, thank you.
seems like you're going to be tripping over that over and over again. And how is that manifested in your project?
So in the second paper that I talked about, it was going to be going down a rabbit hole if I brought this up, so I left it out of the presentation. There's a component of that paper that talks about professional identity and how when people are telling us their stories, they are narrating them from a perspective of sometimes this is the field I'm in. It might not be the organization that they're loyal to or that they feel association or belonging to. It's I'm a nurse and I'm going to be a nurse forever. Like it's that. And so we absolutely use that literature as well and bring that in because that's what we hear over and over. Yeah, of course.
Thank you so much, Dr. David, for a great presentation. My question is regarding the first paper, specifically regarding the methodology, scientometric analysis. I was just curious to know, in terms of the range, in terms of number of the studies that you're considering for the study, and at the same time, would you like to also observe a trend analysis from 2013 until 2024 in terms of the scholarship changes and also the trends, and also its intersection with the recent technological transformation in digital tools, because especially in every area, but also in the health area as well, I believe the more digital tools has improved and technological transformation has happened, the less interaction between the frontline workers and the clients, basically. So would you also see those trends and nuances?
Thank you.
Yeah,
thank you. These are really great questions. So as far as how many and the trends, I did not present those results today because we are finishing up the analysis portion of that paper, and Connie Stovall, our data person, is not here today. And so I hesitate to tell you how many, but it is in the tens of thousands that are available. That is not what we will end up with a systematic review, obviously. There will be inclusion-exclusion criteria for the next phase of this project, so that will be whittled down significantly, I would imagine. I'm looking at what's possible at this point. As far as trends are concerned, we have a funny spike. So there's a trend of the number of articles going up from 2013, and then there's this huge spike in 1 year, and it comes back down and continues. And we are trying to ascertain what's going on there. And it's pre-COVID, so I'm not sure. We're trying to figure out maybe an external variable that we're not considering, but we're working on that. But I appreciate the question. There is a trend with one big outlier. And finally, with the frontline interaction, I think this is why this question is so important for now, because technology is evolving the way we interact with one another on a very basic level. And so I think, something that would have required a doctor's visit 10 years ago is now taken care of with a 5-word email through a portal. That's still being on the front line. That doctor getting that 5-word email is still on the front line, serving. It just has a different qualitative aspect to it. And so that's why I'm very interested in these contextual elements of frontlineness that kind of structure how we go about behaving in a frontline role. Does that answer your question? Of course.
I want to invite anybody out in Zoom land. Feel free to jump in with a question or comment if you have one. Otherwise, I've got a couple of questions, if I may. They're kind of related, possibly. One is the use of the term frontline. do the people you're working with the paper 2 interviews, do they use that term to describe themselves? No? Okay.
In fact, in a survey, a very brief survey that we did after each interview, we asked them to quantify the amount of work they do that is on the front line, the percentage of time. So are they 60-40? Are they 20-80? How much time do you spend face-to-face with service recipients? I believe that's close to how we worded it on the survey, and they picked percentages. There was a slider on the electronic one, if they had that one. But very interesting results that I'm not prepared to report yet.
Very good. And then second question is, again, regarding the people you interviewed for the paper 2. How did you recruit those people, and did the process of recruitment affect the kinds of people and the kinds of responses you got?
This is a really good question. So I think the answer is yes. The selection process did affect what kinds of answers we got. However, that was intentional. I think that finding out what people would say in this particular environment and at these particular kinds of facilities was the goal. And so it's not like we set out to do a random sampling of public health workers throughout the Commonwealth. This was a different project than that, and I think that would be a very worthy project. But we're missing some of that qualitative insight into frontlineness and what it really means for people. And so I think doing the interview approach was, even with some of the limitation on being generalizable later on, is worth it. It's worth the risk. So yeah, I hope that has answered your question.
Yeah, thank you.
Of course.
We have a question on Zoom from Su Fang.
Oh, great.
Hi, thank you for this talk. My question comes out of ignorance and complete unfamiliarity with your field. I was just wondering about the differences between people who work for the government and then people who might work for a corporation like a hospital. And I was wondering, it seems to me the term frontline puts together two groups that may have very different have very different, that the public perceives very differently. And I'm also been, and this is because, particularly, last year with the firing of the Fed workers, some of whom, of course, I think would fit under your frontline definition. Mm-hmm. The people, of course, who work for like the Social Security, for instance, might be considered frontline, I think, by your definition, that interact with the public, right? Or even the people who work in the public parks. And I'm just wondering, sort of like, but the perception of the public, and of course this public is very variegated, that, different pieces of the public view people who work in the feds differently. I understand that. So I'm just wondering if you have any thoughts about sort of like this kind of categorization that seems to obscure the line between the federal or the public workers versus private. Mm-hmm. I know you did mention it, but I was just wondering if you have further thoughts about like what use or utility that might be in kind of making those distinctions. Okay, thank you.
Thank you for the question. That's probably more than I can answer today because it's something I'm going to be thinking about for a long time. But my first inkling to answer that question is that I'm not so sure the public sees that bifurcation all the time. I'm not so sure that service recipients don't expect similar things from private employees versus government employees a lot of times. I think there is something to, and I don't agree with this, that government should be run like a business, but I think a lot of times service recipients act and expect a lot of the things that customers expect, right? And so that's the way I'm going about thinking about the different categories of potential people who might be involved in these public interactions or public encounters. But I
don't have to tip the person at Social Security.
It's true.
Yeah.
But with the preponderance and increasing of tipping culture, you see a blurring of lines of expectation, right? Like, just because it's part of the software doesn't mean it's appropriate, right? I don't expect my doctor to turn an iPad around. You're exactly right, and ask me for 15% on the bill. First of all, they'd have to determine what the bill is. But yeah, there is some separation there. But behaviorally, I really wonder if there's a lot of difference in expectation for what the recipient gets.
I guess I was thinking more about not behavior so much as kind of public discourse about the value of public servants versus
Yes.
non-public servants. Yeah.
Absolutely. Great follow-up, and I'm really glad you said that because this is a long game for me. That question right there is a long game because I think there's a lot of potential in studying how society values public servants, and in particular, frontline public servants, over the course of time and how that changes. There's so much variation to explore there, historically and going forward as we watch events unfold before us. So thank you for that.
Any other questions, comments? All right, well, I think we can wrap things up. I've just got a couple of quick announcements, if that's okay. Next week, of course, is spring break, so we will not meet as a seminar next week. But the week after that, 2 weeks from today, we will meet, same time, same place, also with a Zoom option to listen to a presentation from Andy McCumber from the Sociology Department called Climate Havens, Safety and Risk in a Warming World. And if you're looking for some kind of connection with the Center for Humanities before then, I've got good news for you. This coming Friday is our monthly writing retreat. So Friday morning from 9:30 till 11:30, we're hosting a mini writing retreat at the Inn at Virginia Tech. We invite you to come join us. It's very low-key. Just bring your laptop. We sit together. We write. We make some progress on a project we're working on. And because we're at the Inn at Virginia Tech, we get some great snacks and coffee and other things available for free. So that's Friday at 9:30 to 11:30. We do encourage people to pre-register just so we can keep track of numbers and know what to expect. And if you go to the Center for Humanities website, or you could just email me, I'll give you the link to a Microsoft form where you can register for that. So hope to see some of you at the writing retreat or future seminar presentations. Thanks again for joining us today. I appreciate the conversation. And let's give one more round of applause to Dr. Bredenkamp for a great presentation.
Thank you. And thank you for your questions.
All right. You got some applause on Zoom there as well. Kind of quiet though.
Thank you.